Welcome to the Medical Associates Health Check. I'm Dr. Bristow. I'm the founder of the Concierge Medical Clinic, and I'm a specialist physician in internal medicine. And I have with me today my co-host.
Hi, my name is Dr. Elisha Salvaraja. I am the clinical administrator and head of accident and emergency at Medical Associates Hospital.
I know, and today we're gonna dive into a nice topic. We're gonna do things through one hole today.
New
One
year,
hole.
new techniques.
Yeah. So we're gonna deal with the SILS procedure, and we have none other than world-renowned laparoscopic surgeon, Dr.
Back
Yadesh Singh.
again. by
Dr.
popular
Singh,
demand.
welcome.
Yeah, thank you all for having me again, and glad to be here in the new season.
Yeah, man. Nice. Good.
So, how about you tell us what SILS stands for?
Yeah. So SILS stands for single incision laparoscopic surgery. So it means that you operate and you do all your different types of procedures through one single incision using laparoscopic instruments.
Is it anywhere in the body or any particular place
Well,
you're
it's
starting with?
the navel.
Yeah.
Oh, we know it as the umbilicus.
Or the belly
Where
button?
there's a natural scar from birth. So we use that same scar to do these procedures. So therefore, when this heals back, you're virtually scarless. So then there isn't any other scar in the abdomen.
Okay. And how popular is this technique now?
It is popular in certain parts of the world, most first world countries, and they're actually even doing them robotically now, and there are special robots that have been created to do it. So there is the drive towards a lot of scarless operation. In Trinidad, I perform them, and we perform them for patients who have, like in our last session, we talked about gallstones.
Yeah.
So for gallstone disease and even emergencies such as appendectomies and colon cancers, it's a bit limited in terms of if you're doing large tumors,
Right.
because you have to deliver large tumors. So a patient with large cancers and stuff, you wouldn't want to do a single incision. You can't deliver it through the navel.
You small, yeah.
So therefore, you will do them with traditional laparoscopic surgery, which is good also.
Just in my own vain mind, I am thinking, right, that this kind of procedure is the right procedure for any woman or man who don't want to see a single scar on their belly.
Why you start with woman first? Why you didn't
Because
start with the
obviously, ladies don't want to see no scar on their belly. You don't want an extra mark. You're probably battling with other things, and you don't want to see no ugly scar on your belly.
Yeah.
So I think that's one of the main reasons why people might gravitate towards this procedure, right?
Yeah.
Just because of the cosmetic option.
Well, I mean, we'll go a bit further because in our population, I mean, we're coming up to Carnival soon.
Yeah.
And we see a lot of people, and they really they celebrate themselves, and
Correct.
and they like to go off. The gentlemen go off and they bareback, and they gym for about 6 months before, and the ladies wear their beautiful costumes or lack of costumes.
Almost bareback, but
Right.
Why
And
did we
I've had patients who actually had gallbladder surgery done Scarless, and went out and played carnival. Yeah. So
tell me something. Because it's scarless, it's similar to laparoscopic surgery.
well, it is a form of laparoscopic surgery
Right.
because we use sports and we use the laparoscopic instruments and the laparoscopic towers. So it is a form of laparoscopic surgery.
So switching back to this scarless incision, how quickly can they recover from the surgery?
Well, it's very similar to laparoscopic surgery. So they can, a patient, let's say, for instance, who had a laparoscopic cholecystectomy done through this technique, they can be home in the same afternoon.
And recovery time for them, so they're back out to daily activities?
Yeah, daily activities almost, within 24 hours.
Oh, wow, that's quick.
But I mean, and all things created equal, we push the envelope in Trinidad. I mean, you're the first man to do this kind of procedure here. And it was a appendix.
Appendix, yeah.
Right? That's like the gold, like bread and butter surgery, right?
Bread and butter surgery,
Yeah. So, in terms of doing a single incision procedure, you will obviously, as a surgeon, pick and choose who might be a good candidate for this kind of thing, right?
Yes.
How you would go about choosing somebody for, having this procedure.
Right. So you want to you want to do this procedure on a patient who isn't obese.
Right.
Patient has to have a certain body habitus, meaning, they could be a bit overweight, but that's fine. I've done them for weight loss surgery, sleeve gastrectomies,
Right.
through Scarless incision. But you have to choose your patients properly. The very obese patient, not a good case. Patients who has large tumors is not a good case. But the majority of patients will be good cases.
Right.
Because,
Do you see yourself performing more Scarless or using the SILS technique in the future?
Yeah, I've had patients who came to me and they asked for it.
Okay.
Because, I've been performing this in 2011. I learned this technique in England. And as we were discussing before, back then, we used a specialized port. But when we came back to Trinidad, the port was too expensive. So I actually had to vary technique. And it's a new technique that was described
Right.
in the surgical literature. And it's called the SILS TT technique.
Right.
Where we use the same conventional laparoscopic equipment. So there isn't any additional cost to the patient, and we perform the same operation, and the cosmetic outcome is the same.
Okay.
Yeah.
And could you briefly describe the technique?
Yeah. So through the navel, you make an S incision.
Okay.
All right, and the S incision gives you a little more laxity in the navel, and we place all 3 ports through this one incision. That's a camera port and your working port, and we'll be able to perform the procedure.
Okay.
But Dr. Singh, not everybody does have a nice navel,
Yes.
right? Like some people just have what we, colloquially we'll call innies, where the navel is go
Yeah.
inside,
Yeah.
and then your navel is outy, where it's poke out, because
Yeah.
maybe you have a small hernia or
Yes.
something there.
Yeah.
Does that affect how you think about planning the surgery? Like, somebody who have a
Well, the
outy?
patients who have the outies, actually the operation is a bit easier.
Nice.
Because they already have a natural defect there.
Right.
So it's a bit easier. So, and we are able to fix that hernia for them also.
One time.
So they get 2 operations.
Nice. I like that. That's one.
So hold all your thoughts here because we're going to go on to a break. Catch us when you come back and we'll be giving you more information about Scarless surgery.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, number 1 healthcare for the entire family.
My name is Jana. I come from UK. I suffered from foot pain. I couldn't walk for a long time. I couldn't stand, and I've been to see my GP in my homeland. They didn't diagnose it properly, just referred me to the physiotherapist who didn't pay much attention either. Last year in October, I came to see Dr. Boodoo as medical associate who examined me and referred me to the in-house physiotherapy. He's given me a one-to-one session, physiotherapy exercises, and I recovered completely now. The people are really nice. Doctors are really professional and experienced. They listen to you. That's very important to patients like me when the professional listen to you. My personal opinion that half of your problem solved when they listen to you. So I'm really happy. I will fly over anytime to come and see them. I can't thank them enough. Thank you very much for the Medical Associates for looking after their patients. For anybody else who haven't been to the Medical Associates, I think they should come and experience it.
Medical Associates Hospital is the most affordable MRI imaging center in Trinidad and Tobago. Patients have quick access to bookings and service, on-time appointments, high-quality, convenient, and fast scans. With $800 off all MRI scans, we guarantee we have the most affordable MRI service in Trinidad and Tobago. Medical Associates Hospital, number 1 healthcare for the entire family. At Medical Associates Hospital, we offer minimally invasive laparoscopic cancer surgeries. This includes liver, gastric, colorectal, pancreatic, and gynecological surgeries. Let's fight cancer together. For further information, call us today, 462-2092. Medical Associates Hospital, #1 comprehensive and internationally accredited hospital in the Caribbean.
Welcome back to the Medical Associates Health Check. So before the break, we were just talking about a little intro into what is SILS, right? Dr. Singh, I mean, every second, every minute, every day, something new is happening in the field of medicine. And there's always constant innovation. When was this procedure described or derived, and how you all came about figuring out that this could even work?
Yeah, well, actually, I learned this technique when I was doing my surgical oncology fellowship in England. We were performing Scarless Scarless hernia surgery, Scarless gallbladder surgeries, appendectomies. When we were there, they had a commercial port. So this is a port that you buy from your reps. But when I came back to Trinidad, the port was very expensive. So therefore, as you said, we had to innovate procedure.
So when you brought this technique back, did you have any pushback or opposition? That's the right word. Thank you. Opposition from colleagues.
Oh yeah, they when I first spoke about it and I told them we can actually do single incision surgery, a lot of people was like, no, that cannot be done, because if you look at how you do traditional laparoscopic surgery, it's triangulation, a lot of ports that you put in over different parts of the abdomen. So until I convinced them, then they and described the technique and published, and so slowly everyone came on board. Yeah.
And have you now part of the training process? Do you train younger surgeons now?
Yeah. So I mean, my job, I work at as a lecturer in surgery. So I train surgeons all the time, and they get to participate in techniques. Yeah.
Good. Every day, every minute, there's something new.
Yes.
What are we bringing that's new to surgery?
Well, I mean, the big thing in surgery, it's now the robots.
Right.
So the robots are literally taking over.
I see Elon Musk have a little he have a new robot, like a humanoid robot, and he have Uber cars that don't have any persons in them.
Yes, I mean, with the advent, with artificial intelligence, robotics, the change in technology, soon we may be in the future having probably a procedure done by a robot only.
Yeah.
However, at present, we still have, the surgeon is still in charge of the robot.
Right.
It's still a master-slave robot.
Right.
So we still use the robot as a tool. The robot doesn't think for itself.
Yeah, but Doc, I think I see you make papers on thing for robot and thing. Right?
Yeah, well, we launched the freehand robot not too long ago, last year, and was a venture together with the University of the West Indies and A.L. Keys and the freehand robot company. And we launched it in Trinidad. We did three procedures at the Port of Spain General Hospital. And with the freehand robot, you actually have control of the camera. So it gives you better control and better precision. When you do laparoscopic surgery, one of the problem is if you're working with an inexperienced camera person, somebody has to hold the camera for you while you operate. But with the freehand robot, you actually control the camera. So you actually get to see exactly what you want and not what the assistant wants. Yeah. So if you're operating on the gallbladder, you get to see the gallbladder, not the stomach. Yeah. All right. So it gives you back control. Yeah. It gives you back control of the procedure in terms of your visual acuity.
Just now the surgeons could practice a little VR headset, and
they actually they actually have. Yeah. They have been doing that. VR, that's a new thing also. And they actually have surgical procedures that you can actually do using VR.
Yeah. So, I mean, apart from the cost benefit to the patients and very likely to institutions that offer this service, you know, obviously the patient want to know that they're doing a procedure that they will benefit from,
Yes.
right? So not really looking solely at the cost, but looking at the value, right? What value does this procedure add to the patient's, quality of life, recovery, and those kinds of things?
Yeah, because you use the robot, you get a better in terms of precision, accuracy. So there are less risk of complications. So therefore, that's the benefit to the patient. You decrease complication rate.
Yeah, and they don't have to stay in hospital no long set of time.
No.
And you're in and out basically, next day.
Yeah. Which is a huge change from what we used to have. Patients were in hospital for 5-6 days, and now they're up and walking and back to normal life.
Yeah, they're up and walking the same afternoon, and they back home, some same afternoon, some next day.
And could you, because there are certain surgeries you can't perform with this technique, especially ones that are looking at more towards the back of the abdomen. Can you see a way forward to create a similar technique that would make this?
Well, there are techniques that you can use, but instead of accessing inside the abdomen, you access in the back. We call it retroperitoneum.
Yeah.
So you can use similar techniques, but the incision would not be done virtually scarless through the umbilicus. The incision has to be in another place. Therefore, leaves the scar.
Okay. Yeah. It'd be interesting if they eventually create a technique for breast surgery that's scarless. I think that would be a popular
Ladies
technique.
would love that. Yeah. Guys too.
Guys too.
Yeah. All right, good. So, Dr. Singh, hold those thoughts, the final thoughts. We're about to take a short break. When we come back, we will delve into just the final wrap-up on single incision laparoscopic surgery.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, number one healthcare for the entire family.
Good day, my name is Dr. Laurent Olivier. I'm a breast surgical oncologist. Today we're going to talk about the breast mammogram machine. This is a tool that we utilize for breast cancer screening. It's the only recommended tool for breast cancer screening, which is actually what we call a 3D mammogram machine. It allows us the ability to take views of the breast at various angles, as you can see how the machine is moving left or right, and allows the computer to reconfigure a picture, a 3D picture of the breast. This allows us to pick up 25% more breast cancers and allows the false positive rate to be reduced by 15%. What that means, the ability to pick up abnormality is actually more accurate than the previous mammogram machines. This machine is readily available at Medical Associates, and the standard of care, which is mammogram machines for screening, is now starts at the age of 40. With the 3D mammogram, it allows us the ability to pick that abnormality and diagnose patients for breast cancer.
At Medical Associates Hospital, we offer minimally invasive laparoscopic cancer surgeries. This includes liver, gastric, colorectal, pancreatic, and gynecological surgeries. Let's fight cancer together. For further information, call us today, 462-2092. Medical Associates Hospital, number one comprehensive and internationally accredited hospital in the Caribbean.
I have always had, a little pain, and I will visit the doctor, get treatment. Most of the time it will be kidney infection and will be treated and pain will subside, and that continued until 2 years ago before I realized what was happening with me. I was advised to do a CT scan, and when that CT scan was done, they found out there was a 3.5 centimeter staghorn stone in my kidney. The doctor indicated that there was a kidney infection, and that is when I was rushed to the medical facility. And I was thinking, okay, maybe they will have to cut, but he started to explain the procedure where it will be just like a keyhole incision. I was so happy for that. When I visit Medical Associates, the staff, they were so helpful and caring, compassionate. They will visit me and make sure that I'm very comfortable in my bed. Whatever is needed, it was done. I am doing everything normally now, no pain. Happy to know that I could do whatever I want. All of my family, whether they eye, ears, nose, throat, whatever, pregnancy or whatever, they visit this hospital. So this is like a family, our family hospital. Treatment you get here, I am happy that I chose this hospital to do my surgery. I now feel as if I'm living again. I have been given a new life.
Medical Associates Hospital is the most affordable MRI imaging center in Trinidad and Tobago. Patients have quick access to bookings and service, on-time appointments, high-quality, convenient, and fast scans. With $800 off all MRI scans, we guarantee we have the most affordable MRI service in Trinidad and Tobago. Medical Associates Hospital, #1 healthcare for the entire family.
Welcome back. So before the break, we were just talking about robotics. Dr. Singh, where do you see the future of surgery, particularly at Medical Associates?
Yeah. So at Medical Associates, we offer a lot of minimal invasive surgery, laparoscopic surgery, and we do laparoscopic surgery for most gastrointestinal problems, especially cancers and stuff.
We've certainly
The
been moved
future-
away from open surgery.
Yeah, we have moved away from open surgery, and I would say majority of operations being performed there are
Laparoscopic, yeah.
minimal invasive and Scarless. Now, the future of surgery at Medical Associates and the wider Caribbean, I'll say, is the advent of the robot. At present, robotic surgery in the world, it's becoming more and more common, and that's because the cost of the robot is getting less.
Why?
Because there are a lot of other competitors in the market now. In the past maybe 20 years, there was one dominant company.
Right.
But within the last probably 5 years, there are probably about 20 new companies, and there will be more. So we have robots being manufactured in India. We have robots being manufactured in China, Japan. UK has their own robot.
So you're mentioning all these different countries. Now, there is often a thought process, and I'm not saying it's the right thought process, but it's often a thought process that things that are manufactured in different countries are not going to be as of high quality, perhaps, as the ones that you expect to get from, let's say, the UK or the US or wherever it may be, or wherever the dominant company is based.
Yeah.
What do you think about that?
Well, especially in medicine, the use of things such as the robots and the laparoscopic instruments, they're really tested and tried. So, there are different varieties of these robots, but in terms of being dependable, most of them will be dependable. A robot being manufactured in a country and being cheaper doesn't mean that it doesn't work as well.
Yeah.
Yeah.
It doesn't automatically equate to inferiority.
Correct.
Or lower quality in any way. Yeah.
So in terms of when we're looking at offering this kind of service, obviously from one as a surgeon, but one as an educator, it's also important that you all train doctors or advocate for them to be trained in this type of specialty. This is, to me, is a subspecialty.
Yes.
Right? So, is you're advocating, and you yourself would train younger upcoming doctors to perform these procedures. So at least there is a demand for this in the wider surgical market, as you would say.
Yeah. So as time go by, robotic surgery will be just as laparoscopic surgery became dominant. Robotic surgery will be dominant, and at present, unfortunately, the only place you can train, you have to go to one of the first world countries.
Right.
hopefully in the future we'll be able to train our own surgeons here
Yeah.
in Trinidad and Tobago.
You know, I think part of the other issue is that perhaps not everyone in the general public knows about the options of Scarless surgery or robotic surgery.
Yeah.
It's probably not well known, and hopefully this segment will help people understand that there are options available to them.
Yeah, I agree.
And that means we'll see more of these new techniques come here.
Yes.
Yeah, I mean, Scarless is a nice procedure. It's sexy, it's neat, clean. It's look pretty after. I mean, on the other side of it too, the patient is benefit, right? And not only in how it looks, but eventually as more and more of these procedures are done, hopefully the cost of the procedure could come down, right? So that there's some kind of, we say, economies of scale. The more you do from maybe even from a robot, if you invest in a robot, then I mean you can bring down the cost of surgery if you do more.
Yes.
Yeah.
So the volume will be the factor
Correct.
in terms of getting your cost down. And not only that, I mean, I'm basically a gastrointestinal surgeon, but bringing in other types of surgeons, the urologists, the do nephrectomies, the gynecologists. And once you have other specialties getting in,
using the robot,
then the cost definitely will come down.
Correct.
But I mean, you're touching on the Scarless surgery. It's like evolution through the centuries. What happened, long ago, you will get almost a 30 centimeter scar, and then in the 1980s and 70s, they made the same operation through smaller, and it's a variety of technique, but also it shows innovation and also the change in instruments. And with the advent of the laparoscope, that changed in the early 80s and became dominant in the 90s, where it had smaller punctures. So it's a natural history now. And you still had scars from laparoscopic surgery, but now with the Scarless surgery, because you're hiding the scar in a natural scar that you have, the patient. So it's a natural evolution of the scar.
Right. Scar going less and
less
less
and less.
Now we're talking about Scarless surgery on the surface level, but we create scar tissue too when we go inside the abdomen. Are there any benefits or risks with the technique intra-abdominally?
Well, I mean, there are always risk of operations of any new technique, but it's similar to laparoscopic surgery. So the risk I would say is similar to laparoscopic surgery in terms of the benefit, because there's less scarring on the abdomen. There's also less scarring on the inner part of the abdomen, so there's less chance of patient developing a common thing after open surgery called adhesions. I mean, adhesions long ago with large incisions, almost 100%. I mean, I've had the opportunity to go in back for an operation. Say the patient would have had a colon cancer operation, and then later on, 20 years later, you go to do another laparoscopic operation, let's say gallbladder, and you look inside the abdomen and no adhesions.
That's amazing.
So it's something that has also changed. That pattern of these complication has changed.
So can you also, let's say you had the colon cancer through this naval incision, can you go back again and operate easily without?
Yeah, absolutely. You can use back the same incision.
Okay. Yeah. Great.
So I mean, like, while a surgeon has his skill sets in his hands and his technique in his brain, the surgeon is moved from place to place to do his work. You know? And Medical Associates has been that institution that has, really tried to be on the cutting edge of, investing and innovating into technology that allows the surgeon to really perform at their best.
Yes.
So I think that, it's good that Medical Associates has, taken the step in this direction, and invested into bringing the Scarless surgery to market. And I think it's a real good thing that you are actually the guy who did the first case. Working here at Medical.
So I've done first cases in colon cancer in the Caribbean and in weight loss surgery in the Caribbean using this technique. There were invited surgeons who came in to different territories who actually performed single incision, and in other territories, some of the surgeons now perform. Actually, we had a collaboration with some surgeons from Trinidad and Caribbean, where whoever did, so there's a paper that we published within the Caribbean now with all the surgeons who did Scarless surgery.
Thank you again for coming on, Dr. Singh. And thank you for watching. If you have missed out any part of the show, feel free to check us out on our social media platforms. And we'll be back again next month with a new topic on a new subject with another doctor. So check us next time.